So you've applied to Queen Mary to study medicine, otherwise known as Barts in London, and you have an interview coming up. So in this video, I'll tell you all my personal tips and all my advice for the medical interview. Now, bear in mind, I've done the interview twice. I applied in 2022 and failed, and then applied in 2023 and got in. So I have a bit more experience with the interview, hence why I will tell you exactly what to do in the interview. Let's get into it. So just the basics. It is a 20-minute interview. It's a panel interview, meaning you will be interviewed by a group of people. It won't be like an MMI, so it's online, and it will be split into two halves. One of the halves will be about yourself, about your motivation to study medicine, your work experience, personal statement, all of that stuff, and the other half will be about an article which they will give you 2 weeks prior to the interview. So just to summarize, 20-minute interview, online panel, and you get an article. Lovely. Are we following so far? I hope so. Common question: what questions will I be asked? I don't know, but I can help you with giving you some ideas. We'll talk about the article in the second half of the video. Let's talk about the common questions that you get on the other half of the interview first. If you're preparing for medical schools, you should be familiar with motivation questions such as, why are you studying medicine? Why do you want to study medicine? Why do you want to study this course? Things like that. You might get questions like that. You might also get questions to do with you as a person, like as a student. What are your strengths? What are your weaknesses? And having that introspective look into yourself is very important, especially for medical interviews. This is not just Barts, by the way. This is like everywhere. You need to have an idea of your strengths and weaknesses. All of those type of questions, they might come up. I can't guarantee they will, but they might come up. And I will leave some resources in the description for you to have a look at. But I want to talk about more of the Barts or Queen Mary specific questions that might come up. And again, I can't really give you the exact question, but I can give you an idea of what they might ask you about. And I think the main thing is for you to be familiar with the uni itself. Just being familiar with all those concepts will show that you're interested and that you want to be a student here. So I'm just going to be telling you about the uni, and you just take what you want from there, and I'll give some suggestions for questions. There is a lot of self-directed learning at Barts. You will have a lot of free time, and a lot of those hours will be studying. For example, anatomy and physiology lessons will require you to do pre-reading, and it's quite a lot of pre-reading. You should do it. You should definitely do it, and I definitely do it every time. I don't, but I'm working on that. Anyways, that doesn't matter. Other than that, you also have PBLs. If you don't know what PBLs are, problem-based learning, it is like a group setting where you and your PBL group tackle a problem or a scenario and kind of brainstorm ideas and set these learning outcomes for the week, and then you come back the next week and discuss your research. Now, what could they ask you? They could ask you things like, at Queen Mary here, we pride ourselves in our PBL sessions. Why do you think the PBL style of learning suits you as an individual? Or for example, they could also ask you something like, there is a great deal of self-directed learning at this university. What makes you think that you can cope with the stress that comes with such a heavy workload? So yeah, it's definitely worth thinking why this style of teaching, this mixture of independent and group work, suits you as an individual. I mean, think about it. As doctors, you will spend a lot of hours doing independent work, but also a lot of hours working in a group. That is why the uni does it. It is very specific to the role of a clinician. There is always big discussion about whether prosections or dissections are better. At Barts, we do prosections. If you don't know what prosections are basically, they're like specimens that have been professionally prepared by anatomy teachers and experts, and they're suited for your learning. In your anatomy labs, you will have prosections, and you will be able to identify structures that you have learned either in lectures or in the pre-reading, and prosections just make everything easier. I think prosections are great because they're professionally done for you. However, if you are interested in dissection, which a lot of people are, for example, people who are interested in surgery will obviously be interested in doing dissections. Don't worry, because you can still do dissections at this uni. There is this thing called the SSC program, which is your self-selected component, and you get, I think, in 2 different occasions, you get 2-week blocks to pick a subject of your own, which you get a list, and you can do dissection of upper limb, dissection lower limb, and you get loads of other topics. I wasn't really interested in dissections. I'm doing medical cupping and a research project on cardiorespiratory function and exercise. Yeah, you get loads of different options, and you can also self-organize your own SSC. So remember, Barts does prosections mainly, so all your anatomy learning will be prosections. But if you are interested in dissections, you can actually do them through the SSCs. So remember that. But I would say that if you are applying to Barts, in your interviews, you might want to say you prefer prosections, but that is the main style of teaching. Okay, next thing is the location. Obviously, the main uni is situated in East London, and you'll spend a lot of your time in East London, especially because the Perrin Lecture Theatre, which is our main lecture theatre, is situated in Whitechapel. It's literally dead centre in Whitechapel, right next to the Royal London Hospital. And then when you do clinical skills, Fields, that's right next to St Bartholomew's Hospital, which is more central London than East London. And then you also have the Bancroft building, which is where you do the anatomy and physiology labs, and that is in Mile End, which is the main Queen Mary campus. And you have amazing hospitals around you which will aid you in your learning throughout your years of medical school, especially in third year when you're going to be doing placements. You will probably be allocated one of those hospitals, which are great hospitals. And remember, East London has a very unique and diverse demographic, and that's very important, especially as clinicians, when you'll be studying about so many diseases and you will see how differently they affect different populations. I would highly recommend looking into the kind of demographic of the area. Generally, it is a very diverse area, especially when eventually you're doing hospital work. You will see how management of different diseases differs between different populations and ethnicities, which is always interesting, and I think it's very important to recognize as a clinician, and it's an opportunity you might not actually get to see in other areas. The Robin Brooks Centre is where you do clinical skills, and clinical skills is basically like all the cool medical student stuff. You get to like learn how to take blood pressures and like using the stethoscope, and you're doing like respiratory exams, and it's all cool stuff. It makes you feel like a doctor. You can also like even book the rooms in the Robin Brooks Centre to practice clinical skills with your friends and stuff, so it's really good. GP placements, you will be in GP literally from either the first week or the second week. The GP I'm doing my placement in, I think I've been very lucky, because I've had some friends who haven't enjoyed their GP placements as much, but I have had an amazing time. My doctor, my GP, is an absolutely amazing teacher. We get lots of learning done, and I don't know how they would ask you questions to do with that, but I think it would be very good if you can manage to mention it in your conversation or in your discussion. Like, you know, I'm familiar with Barts having, or Queen Mary having, regular clinical skill sessions and GP placements, and I think that's something that is very good as a developing clinician. Blah 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 blah. Personal statement was relevant for me both the times I did the interview. I don't really know what they can ask about your personal statement, but what I'd recommend is having a read of your personal statement again and having a think of what questions they can ask from it. So for example, if you've mentioned a particular hobby, be prepared to, you know, answer anything about it. If you've mentioned a particular book or article that you read, be prepared, because they might generally ask you about it. So it's worth being familiar with the personal statement. Now this is probably the most important one, and this is the most notable one that I can remember from both my interview experiences. They really want to know what you can bring as a student to this university. Think about what qualities you have that can aid to this university. A very easy way to do that is probably talking about the societies. Barts and Queen Mary, they both have so many societies. I would recommend just going on the Queen Mary website or the Barts website and having a look at the societies they have and see what interests you. Talk about what you can bring into those societies, or maybe you can make your own society. I would make it personal, because saying something like, I'm a very hard-working student, that's why I deserve to be here, that's not really going to help you here. You want to come across as an individual, because they're looking for individuals with unique attributes. No one's boring. Everyone has something about themselves, so figure out what that is, because you need to be able to vocalize that. And I know that's hard, like to actually talk about yourself and think about yourself. A lot of people don't do that, but I really do recommend for these medicine interviews, think about yourself, think about who you are, think about what you represent, thinking about who you represent, think about what you can bring to the table, think about your strengths, your weaknesses. It's all going to be very important. So yeah, that's that section done. We're going to talk about the article now. Just before I start, I want to preface, the article section will either be the first half of the interview or the second half. Don't think it's going to be the first half or the second half. It can be any. So I don't know what the topic of the article is going to be this year, but from my experience, it's always something that's recent. So for example, in 2022, it was about COVID, and in 2023, it was about a recent clinical case that was going on at the time. What they are testing is your ability to communicate confidently about a healthcare topic, and also be prepared to answer questions that might be challenging. Don't just read the article and forget about it. You actually need to do a bit of work around it, because what they're really seeing is how proactive you are and how you can communicate, how you research and how you think. They're really testing a lot of skills here. So first of all, just reading the article, you need to familiarize yourself with the topic and the content of the article. If there's any keywords you don't understand, make sure you learn them and familiarize yourself with them, and also just brainstorm ideas that come to you. I'd recommend literally just sitting with the article, either print it out or on your iPad or whatever device you use, and highlight or annotate whatever works for you, but just have that proactive thinking. because that's what's going to generate the discussion that they will probably have with you in the interview. I also recommend kind of reading outside the article. Like, you don't want to just stick with the article, you actually want to do a bit of outside research, maybe read some other articles, maybe watch the video, and I'm sure that will help. So yeah, just be very familiar with the subject terminology and make sure you can actually use it in your own vocabulary when speaking about it or when discussing. Okay, I know for a lot of you, you've left behind English in GCSE, but there is a bit of analysing we need to do. I'm going to use the 5 W's. I'm sure you know what the 5 W's are. So we're going to use those, and I'm just going to give you a list of questions to think about. So, you need to think about who wrote the source, who is it for, who's the audience, what information is it sharing, what is its goal, what is its purpose, when was the source made, and very importantly, have there been any recent developments? Because there might be. Why was the source made? Is it to persuade the audience? Is it to inform? Have a think of that. And for where, I mean, that's kind of difficult, but where was the source made? So it's just to kind of generate discussion. You don't have to follow a specific structure. Yeah, it definitely does help if you approach it like a essay or like a literature piece. You actually analyze it and think about it a bit more proactively to generate discussion. Medical ethics, I'm not sure if it's going to be relevant. For me, it was relevant. I think both the years, I'm not too sure, but definitely the year I got in, it was very relevant, and it was the majority of my discussion was around medical ethics. This goes for any medical interview anyways, but be very familiar with medical ethics. Obviously, the 4 pillars are autonomy, which is a patient's right to have a right to their body and their care. Beneficence, which is your obligation as a doctor to do good and to kind of have that patient-centered perspective. Next one is non-maleficence, which is to do no harm, kind of the opposite of beneficence. And finally, justice, which is your obligation as a doctor to follow the law and do what's best for the public as well. And things like resource allocation are important when talking about justice. Medical ethics is very difficult. They don't expect medical students to be expert medical ethics people. Not even doctors can do this stuff properly. It's very difficult. It's a very complex thing, and that's why we have ethic boards and stuff who sit down and discuss these things when making these clinical decisions. However, it's important you're familiar with the terminology, and again, it's important for you to be able to use that terminology in discussion and actually speak about it comfortably and show that you're thinking of multiple perspectives if it's relevant for the article. I'm not sure if it will be. There is a book called Tony Hope's Medical Ethics, a very short introduction. This is a very good book. Read this. I read this like 2 years ago. It's really, really good. I'm sure you guys have seen this book as well. I'll get back to this in a bit. I'm going to link some videos in the description that might help you, because yeah, if the article has some medical ethics in it, you need to know how to discuss it. You want to look at the article, go sentence by sentence, and just kind of brainstorm ideas of questions they might ask you. Remember, they're not going to ask you to recall a direct quote or anything. That's not going to happen. So don't worry about memorizing. Don't memorize the article. You don't need to do that, okay? Sorry, I sound really aggressive, but just don't do that. It's better to just think about it proactively. Just warm up your brain and generate ideas. I think I might have said that like 10 times now, but I mean it. Like, it's important. Okay, and finally, and most importantly, actually, I want to say, is your delivery. Your delivery in the interview and your practice and how much practice you put in will make a difference. What I recommend is practicing, literally just practicing. You want to familiarize yourself with the subject, and you want to familiarize yourself with the vocabulary so that you sound eloquent and you sound confident and you sound comfortable. So practice, practice, practice. How do you practice? Well, what I did is I literally just recorded videos. I would literally just sit down and talk to myself for hours. That sounds so sad. That was the best way for me to, you might judge me for it, but I think it helped me. I want to say, actually, my delivery in my second time applying to Barts was great, because when I talked about my article section, because I covered everything, I knew the content in that article inside out. I knew everything they could have possibly asked. When I was talking about it, I covered everything they would have wanted me to say. So they didn't ask me the questions, and that could be you if you put just some time into practicing. Now, practice with friends, teachers, family, whatever works. I practiced with my good friend Neil, who's in Birmingham Uni studying medicine too, and we actually practiced with this book, which I said I'd get back to. So it's quite an old book, but it's very good. It's very good. What we would do is we would literally just open this book in a random page and ask the question. This might not be Bart specific, but this is probably just interviews in general. Oh, I don't know if I said this already. The interviews panel, but you actually get to speak to student ambassadors in a waiting room before the interview, so you're not going to be like super nervous or anything. anything, you actually get some time to relax before the interview. I hope this video answers a few questions that you might have had, and I hope it's helpful. Other than that, that's it. That's me done. If he does med, that's my Instagram. Follow it. Don't stress about interviews. Don't stress about them. You will be fine as long as you put some practice into it. I look back at interview practice days and I really miss it. It was fun. I had lots of fun with friends. So don't overburden yourself. Don't overwhelm yourself. If you need any help, if you have any questions, I'm here. You can message me. I have a lot of work to catch up to. So goodbye.